Welcome to Aging Insights. I'm Melissa Chalker, Deputy Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers, the primary focus being to share important information and connect people to community-based programs. Today we're going to talk about smoking, the risks, the complications, and most importantly, how to quit. Maybe you or a loved one are having trouble trying to quit, but you know it's necessary for your health. Hopefully today we can give you some advice and guidance on how to quit. Our guests are Debbie Riscica and Deena Cohen from the Central Jersey Family Health Consortium. Welcome, ladies. Thank you both for joining me today. So Debbie, I did want to start out with you, if you wouldn't mind telling us a little bit about the Central Jersey Family Health Consortium and what you all do there.
Certainly. We're a maternal child health agency, and we are mostly made up of grants that work with families, mothers, babies, children, like one family at a time to ensure health. And we're very much out in the community. We do a lot of education, we do a lot of support work, many different grants. They're always changing. Our particular grant is the Perinatal Addiction Prevention Project. Basically, our job is to try to help reduce the risk to women of childbearing age and their unborn children due to drugs, alcohol, tobacco, things of that nature.
So that's why, even though you focus on younger people and particularly maternal health and women of childbearing age, you're here to talk to us about older adults, but specifically you're here to really talk about the risks of smoking and how dangerous that is for people and what the health risks really are. So what I wanted to start out with was just if you could explain to our audience what the dangers are of smoking and what the health risks are that are associated with that, for those who may not recall.
Well, the problem is that the toxins in the smoke, there's about 7,000 toxins in tobacco products, cigarettes. 1%, the nicotine, is not what gets us in trouble. That's the addictive piece, but that's not what gets us in trouble. The problem is there's 6,999 other toxins that we're taking into our system, down into our lungs, it's getting into our bloodstream. And the problem is from those chemicals is we can have our arteries start to close, our organs, everything is deprived of oxygen, so things really can shut down. So it's certainly a whole body disease being addicted to nicotine.
Sure.
It really is.
Yeah, and we're going to talk a little bit about the different health ways that this impacts our health by smoking, and you mentioned some of them already, but we have to keep in mind, as we're talking about older adults as well, that it's not just the person smoking who's putting themselves at risk for these things, but there's also the issue of secondhand smoke, and I believe you even told me there's a thing such as third-hand smoke. So if you maybe could explain a little bit to us about second and third-hand smoke.
Certainly. Second-hand smoke is the direct smoke that's coming off a smoking product. That it contains a lot of the same toxins, if not more, than what's in a cigarette. And when those toxins combine with dust particles, they can become just as unhealthy, if not more, to other people in the room who may not even smoke. So that's the secondhand smoke. And the reason why smokers have sometimes a smell after smoking a cigarette is because those toxins cling to their clothing and their skin and their hair. That's the third-hand smoke. And truly, these toxins can last on surfaces a minimum of 8 hours per cigarette. So if you're a caretaker, if you have pets, if you're living with other people who have illnesses that might make them more prone to getting ill, the healthiest decision anyone can ever make is to quit smoking. But at least if not, to take it outside and to do that safely. Which is away from open doors and windows. Make sure you wash your hands as soon as you come in so you're not spreading those toxins.
So that third-hand smoke, you said, is from staying on your clothing and your skin from contact with a cigarette via smoking. And so does washing hands really get rid of that? Because you said it can stay up to 8 hours. I mean,
it's not going to get rid of it totally because it's still on everything else. But certainly if you're picking up child you're caring for, or you go to pet your dog, at least you're taking those toxins off your hands.
Yeah. So,
best would be go take a shower, wash your hair.
right,
know?
and think about people who smoke. I mean, and really, in order to keep everyone around you safe, having to do that after every cigarette. You could see all the reasons piling up as to why quitting is a good solution to that. So I did want to, talk a little bit more about that second and third hand smoke, because as we talk about the older adult population, they have grandchildren or great-grandchildren that they might be in contact with, but also they might be a caregiver for a loved one, a spouse or someone else in their life. And so that idea that if you're smoking and you're bringing that smoke in with you, even if the person's not sitting next to you when you're smoking, you're bringing that smoke and those toxins in with you on your clothing, on your skin when you smoke. So I think it's important for people to know that.
And little children breathe more rapidly than we do. So they're taking in those toxins much more quickly than we are. And sometimes, they can't change their position. They can't get up and walk away. So even folks who only smoke in the car when there are no passengers in it, it's all clinging to the interior. So, you put that child in their car seat, they're just surrounded by those toxins.
So that's all, I think, really important stuff for our audience to know and remember as they think about these decisions. But I did want to continue to talk about the effects, obviously, directly on the person who's smoking. So you talked about all the toxins that are in cigarettes and effects on arteries and lungs and getting into your bloodstream. So what are some of the diseases that we see directly correlated to smoking?
Well, multiple cancer. Types of cancer. Of course, lung cancer, mouth cancer, kidney cancer, bladder cancer, pancreas cancer, liver cancer. It just really can compromise the body's ability to not take hold. It really compromised the whole environment. Thousands of those toxins are cancer causing.
And I think, in particular, you mentioned earlier to arteries, and so this is why we see that doctors talk about the risk between smoking and heart disease, right?
Yes. And once you quit, no matter what age, you really can cut down your risk of heart disease drastically. You can get to a point where your heart is as healthy as a person who may not have smoked. Which is kind of a good thing.
Yeah, it is kind of a good thing. So that is exactly one of the things I wanted to talk about with you is for people who say, that they get to a certain age and, I've been smoking since I was young and now I'm too old to quit at this point in my life. Why bother, right? So that's really not true though, right?
It's not true. Our bodies are pretty resilient. And regardless of how long you've been smoking, once you quit, you're getting a better flow of oxygen. Your lungs are turning pink again. They're starting to. You have more energy. You just feel better. Your breathing is more relaxed. Overall, you just immediately feel so much better.
So it's just that idea that, there is no age where it's not worth it. There is no I'm too old to quit, right? Everybody should say, I can quit, and they will see at least some health benefit in doing so. Is that right?
Or at least give it a really good try. It is the most addictive thing there is, so we have to really help folks and support them in the process. But it can be done.
It can be done.
Be done.
And we are going to talk a little bit more about how to quit and how to support people who want to quit, because I think that's a really important piece about this. But I don't want to jump too far ahead. I want to make sure we cover all of the risks and damage that smoking can do to folks. And so as we think about that and the reversal of it, it can be really difficult, as you said, to quit. But some people talk about reducing the number of cigarettes. Is that helpful in any way? Is there any harm reduction in reducing the number of cigarettes you smoke a day?
Certainly. The less you take in, the less toxins floating around. But in terms of your physiological health and what those toxins are doing to your system, it doesn't really matter.
Right.
Doesn't really matter. Certainly, if someone can get down from a pack to a couple a day, that would be wonderful. And that it certainly is harm reduction. But again, we also have to think about that secondhand smoke and the third-hand smoke. If people have upper respiratory problems, they can be exacerbated by the smoke as well. Stomach issues. It really can. So, healing is even a problem. I know there are many, many surgeons who will not do some surgeries until a person is nicotine and toxin-free for a specific amount of time, because it really can compromise healing.
Really?
So even a small cut can become problematic.
Well, that's really interesting to think that it also affects that aspect of your body, because there's so many ways that we've talked about already that it impacts us. You know, people oftentimes think of some of the more immediately visible things, you know, like damage to your teeth and skin and those sort of things that people can see right away. But there is that also internal damage that we've been talking about, as well as this ability to heal, which is new information to me. I didn't know. I think that's important for our audience to know that that's also a factor, because as we talk about the older adult population, we're dealing with people who might be dealing with multiple chronic diseases.
Right.
So I imagine that this might impact their ability to manage those chronic diseases. Would that be correct?
Yes, absolutely. Also, it interacts with medications, not all, but some, either rendering them less effective or increasing the potency of the interaction going on. So it really does need to be taken into consideration in terms of healthy lifestyle on many, many levels. It really can. Even psychiatric issues can be worsened by smoking.
Right. You mentioned nicotine being, you know, a small percentage of what's in a cigarette versus the other toxins, but it is the addictive part. And so that's the important piece, that this is the part that's, you know, very addictive for people and the part that's difficult for them to separate from. So I think that's going to be important in us talking about how to quit, right?
Yeah.
So let's talk a little bit about that. As we did talk about, you know, people who might say, I'm too old to quit. It really is a struggle. I mean, you think about somebody who's maybe, you know, 50 or over or 60 or over, who's been smoking since they were a teenager. That's a really long time.
Yes.
And that's not only the addictive piece, but also the habit and the way they've built it into their daily lives. So for someone who says, you know, I really do understand that I need to quit, but I don't really want to. How do you talk to them about doing that?
First, truly start with how come? Why don't you want to?
Right.
You know, really break it down for a person so they can map out their own benefits that they can gain from quitting, and the cons of continuing to smoke as well. A lot of the work that we do is to educate on nicotine replacement therapies, which we do encourage. It's medication that helps people get rid of the physical withdrawal from that nicotine, so that then, with the help of maybe group or individual counseling, they're able to, and making other behavioral changes, they're able to do what they need to at least keep putting off that one cigarette in front of you. And before you know it, it really can be successful. And we do have 7 medications that are FDA approved to assist people with quitting. And they can be used in different combinations, and you can pick the ones you want. It's very much a personal thing. And most insurance companies will cover at least some of the medication.
Well, that's good to know,
Yeah.
So I did want to maybe transition over to talk to Deena a little bit, since we've started this topic of how to quit. And Debbie mentioned some of the medications and different things that are available. And I just wanted to know what things you've all seen be successful in terms of quitting. What are the options, and in terms of those options, what have you seen be most successful for folks?
Well, I can start with, first of all, Debbie tapped into literally everything that I was thinking of, and I'm like, oh, she'd mentioned everything as it was going along. Let me start with why people are not successful. And it's been not support. So Debbie talked about having a support, whether it's group or individual. Most people is 7 to 9 attempts at quitting before they're successful at quitting smoking. So even though you haven't been successful in the past, this is one of those things, try again.
Right.
Medications not being used for long enough periods of time and not high enough doses. You know, contrary, we're becoming very conscious of medications and not using. This is one of those anti. The more medication you use, the better people are, the more successful they are. So we usually put people at a higher dose nicotine patch because we find that there's not going to be negative results. They're going to be more successful because they're feeling less of the effects of withdrawing from the nicotine. And like Debbie mentioned, the nicotine being the most addictive substance on the planet, that's the issue that everyone's dealing with.
Sure.
So we promote, when we do groups, is using high levels of nicotine, using them usually for longer periods of time that maybe the box is telling them to use it for. This has been a habit that's been in place for many years with these individuals. So you're not going to get rid of it. You haven't been smoking for a month. A month is not a long enough period of time to get rid of the habits. So there's no negative effects. I had once done a group, not even with smoking, and there was a man in this group that told me he was using the gum for over 20 years, the nicotine replacement gum for over 20 years. The point was he wasn't smoking. And the nicotine does not necessarily cause health issues, negative health issues. He wasn't exposing his family or himself to all those other chemicals. Whatever he needed to do, he wasn't smoking.
So what I'm hearing from you is that there really is no wrong way to quit. It's very individual because everybody's going to react to these things differently. And the other thing is that, I want to make sure we emphasize that, what did you say, it was 7 to 10 times that somebody tries?
Yeah, 7 to 9, 7 to 10 times, yes.
That someone tries. So for those folks who are thinking about quitting or who have tried before and are giving up and saying, oh, I'm never going to be able to do it, if you've tried 3 or 4 times, don't give up. Try again because you might find that time that it really sticks. In terms of the medications, people should ask their doctor about these to start out, or there's some things over the counter, right?
Yes, most of the products actually for quitting smoking at this point are over the counter, and like Debbie mentioned, with insurance companies covering it, doctors usually have to write a prescription. Even though they are over the counter, when the doctor writes the prescription, the pharmacists can zero out the receipts, and that's how it's done. With Medicaid, it is 100% reimbursable. People like us, smoking certified tobacco treatment specialists, which Debbie and I both are qualified. We went to the Rutgers School of Alcohol and Drug Studies and got our certifications, and that actually we're able to put together treatment plans for these individuals and help them. There's a New Jersey Quit line that's available where there's individual counseling to help these individuals to put together, because it is, like Debbie said, there's not a one-size-fits-all. It's very individual, and it's for that individual to decide for themselves what fits into their life best.
Sure. And I think that's something that we can't emphasize enough, that this is what fits into your life best. How can you accomplish this task of quitting smoking? And I want to make sure we let people know that, as you said, there's a lot of nicotine replacement therapies out there, the drugs, the patch, the gum, and to consult a professional when choosing those things for help, but that this piece of the counseling can really be a help in addition to just doing the nicotine replacement drugs, right? You can...
Oh, absolutely. Groups in general are very supportive because, it's not just the counselor, but it's the individual sharing that they're going through the same experiences at the same time. It's having the support. Oh, well, I tried this worked for me. Oh, really? And you hadn't thought of that. So it's the interaction that goes on. It's being with other people that are dealing with the same thing at the same time. I did mention the over-the-counter products, but there are prescriptions. There's prescriptions that work very well, that are by prescription only. So having the conversation with the doctor, with a certified tobacco treatment specialist, is really important because there's some great helps out there. The science is getting better and better, and with that, that's where you need the professional help.
For someone to be able to tell you, well, this is why this would work, and maybe talk to you about what other medications you're on, because as Debbie said, sometimes there are interactions with these things, so you want to make sure that you're talking to a doctor or pharmacist or some other professional who can give you great advice on those things. It's all super helpful, really is. So as we're talking about the medications and the support groups and these things, I was thinking about, support of those around you as well. So in addition to counseling, it's important that the people around you are supportive, and it kind of reminded me when we think about individual and group counseling and also support of your family, that this is similar to other addictions that people might be fighting. And I know part of your program is not just dealing with nicotine, but also other addictions. So how do you see this affecting people who might have multiple addictions? Is there a particular model in which you address all of these at the same time? Is it best to address them individually? Kind of how do you tackle that as a professional?
I'm smiling because I'm really glad you asked that question. Again, with the science, years ago, Debbie, I'm not going to say our ages, but it wasn't necessarily like, all right, you're just dealing with maybe heroin or crack or cocaine. Let's take it one step at a time. the new science actually shows quitting all addictions at one time is the way to go. People are the most successful that quit smoking with the other addictions because they're finding that smoking is a trigger to trigger back alcohol use, drug use. So people that have the less relapses with drugs and alcohol have quit smoking at the same time. That's really what the research is showing. So even a lot of residential treatment centers are banning smoking and other addictive products, sugars, caffeines, because they're finding it's a whole comprehensive, it's a holistic, looking at the entire person. If I'm treating my nicotine addiction like I'm treating my alcohol or my heroin, it's, you know, I can talk to my sponsor, I can talk to my counselor that I'm having triggers, that I'm having issues, and encompassing it, I want to be a better, healthy person, all in all, and that includes quitting smoking at the same time.
Yeah, and that that makes a lot of sense, because a lot of times these addictions coexist with each other, not just because this person may have multiple problems, but because they are triggers.
Absolutely.
I mean, you go to a bar and people are drinking and you're going to continue smoking, which is why I thought it was also important to bring up the support of those around you, because if you're living in a situation where the people in your home smoke or you hang out with people who smoke, quitting is that much harder because when you're with those people and you're seeing them do that activity, it really triggers you to want to smoke as well, right?
Absolutely, and that's where group comes in. And you could talk to somebody else in the group and say, well, how are you dealing with this issue? One of the first things I say in group is tell on yourself. Immediately tell everybody that I'm quitting smoking, because, it's like going on a diet. If you tell on yourself, then when you reach for that slice of chocolate cake, your family's like, hey, you just told me you're on a diet. The same thing with smoking. It's being accountable.
Yeah.
So if you tell on yourself and you put it out there to everybody, I'm quitting smoking, even if there's other smokers in the house, they still hopefully will still be supportive of the fact that you're trying to quit.
Right. And that idea of having, holding yourself accountable, but also asking others to hold you accountable is great. Like the group is a great way to have kind of an accountability partner, but it'd also be great if you could have that with maybe it's the person you live with who also smokes, and maybe you could do it together. And try to accomplish that together and keep each other accountable, right?
Yeah.
I mean, I'm sure it could go the other way too with, we'll just have one, right?
Right.
But, hopefully they can hold each other accountable and maybe be successful in that.
Yeah, and of course it's easier if you have the support of your family and friends and everyone's doing this together, because you're right. It's easy when you're around your family who's not smoking all day to not pick up that cigarette. And we hear this time and time again. It's when I'm around people that are smoking that it comes back for me.
Sure. Yeah, I mean, because it's a habit, right? And we get into that routine of it, and when you see it, of course, you're going to want to.
Whether it's a good habit or a bad habit.
Either way, right?
Yes.
We get into those daily things. So, as we're talking about quitting and ways to do it and all these things, I want to make sure that we address a really important topic, which I know you both talked to me about off camera, which is this whole new e-cigarettes and vaping, and how we see a lot of young people utilizing these things, but we also see older adults who might think that they are doing another harm reduction, that they're using it as a tool to quit, and whether or not that's really a safe thing to do. So if you could talk to us a little bit about those two options.
Our stance has been going forward, we can't stand up here. We have our hypotheses, but we don't, use our hypotheses. It's not the Debbie and Deena show.
That'd be a good show.
It would be a great show. We have to use science and research. And as of right now, we do not know that it's a harm reduction. We do not know that it's a safer, healthier alternative to smoking. So as of now, we can't promote that. Probably about a month ago, would you say, the FDA is now going to regulate cigars, because cigars, people also do not realize, have the same amount of toxins and nicotine, if not more nicotine, than cigarettes.
Right.
The difference is wrapped in tobacco leaves versus wrapped in paper. That's it. Still just as dangerous. The FDA is now going to regulate cigars, e-cigarettes, vapes, electronics, rechargeables, modifiers, all those, the hookah pens, all the encompassing.
There's
and
so
the
many
flavors,
things. Yeah.
yes. So the research now with the FDA will hopefully speed up, and we'll start to see the research, the science come out of what really is in these products.
Right.
But we can't promote them as a healthier alternative, and we just want to get the message out to older adults, to younger kids. Younger teen smoking is going down drastically. But that's really like a misnomer or a confusing statement, because electronic cigarettes are going through the roof for them. Kids that would never pick up a cigarette are picking up electronic cigarettes.
And that's and I don't want to get off on a tangent, but that's a lot to do with the fact that you can get flavors in these things, right? And that's really appealing to, I think, everybody, but to children in particular.
To towards kids, to
teenagers.
women, flavors. And that's what makes it more appealing. And the FDA got rid of, when they started regulating cigarettes, flavored cigarettes came off the market.
Right.
So now there's still flavored cigars, which are used for other purposes as well. Those the FDA will also eventually take off the market. And when they take the flavoring out of all these, they're calling them ENDS, electronic nicotine delivery systems, which encompasses the vapes, all these things that are a mouthful, the ENDS. When they start taking the flavors off the market, let's see how much the rates go down in the use, because the flavor is absolutely the hook.
Yeah, and I think that's all really important for you to explain to people, and why that's marketed in that way, and why people are using it, because we don't have proof that this is safe to use. I mean, I think as you talk about the FDA, there have been concerns about vaping and electronic cigarettes, because it's still heat. Right, that's going in. Is that what I understand? That it's still something that's hot, and that is also damaging to the esophagus and other.
And they have found metal particles in the vapor that is coming out of it. We're not really sure. I don't mean us. I mean the community is not sure what is in the vapor, how the vapor actually takes place. But in the vapor, they have determined that there's higher levels of formaldehyde than there is in traditional tobacco cigarettes. There are metal particles that are in the vapor. And remember, our lungs are only capable of absorbing so much, even vapor. Even liquid vapor, that it starts to settle in the bottom of our lungs. So when these metal particles in the vapor start to settle in the bottom of our lungs, the formaldehyde is settling in the bottom of our lungs, what is that going to do? What kind of diseases? Emphysema, COPD, which smoking causes, is a strong possibility with the vaping and the ENDS as well.
Right. Great. I think that's all really important for people to understand, all the ways to protect themselves, and that some of these things are risky, and that you should probably think about or consult a doctor or some other professional before you choose an option. But I also want to make sure people remember that, as you both have said, that quitting, there are lots of options and choices to make, but there's help available. People can contact professionals such as yourselves. Is there a way to reach, like a hotline? I know there's a Quit Line, right?
The New Jersey
Quit Line. Is there another hotline where people can find a certified addictions counselor that deals with smoking? Is there a way to do that?
There's a 211 line.
There is.
Which, you can get information, and there's an addictions component to the 211 line, which could put you in touch with us. There are 3 consortiums in the state of New Jersey. There's the Moms Quit Connection in the southern part of the state, but they do have people available in the central and northerner parts of the state. You certainly can contact our agency, and even if it's not somebody in one of our 6 counties, we would be happy to make the referral exactly to the appropriate other counties.
And perhaps the best advice is to always ask your healthcare professional, whether that be your primary care doctor or another physician or medical professional, if they have a referral they can make to you for help, right?
Yes, of course.
Well, thank you, ladies, both so much for joining me today. I really appreciate it. I think you've provided a lot of information for our audience, and I hope those who are struggling to quit can use some of this to get healthy.
Thank you.
Thank you.
Thank you.
Very much. Aging Insights is produced by the New Jersey Foundation for Aging and is made possible by donations to the foundation. To become a sponsor for Aging Insights programs, please go to our website at www.njfoundationforaging.org or call our office at 609-421-0206. All of the previous shows may be viewed on our website. We want to remind you, to find out about senior services in your area, please contact your county office on aging. Their numbers are on our website, or you can call the state hotline at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.